Hi everybody, this is Dr. Kramer and Miss Michigan 1997-98 Kathy here. This is kind of a nice little story. Kathy has been a patient with me on and off since, was it 93?
97.
97. See, my memory is failing us, okay? And she had a variety of health challenges, and we've kind of kept her going, kept her physically active. She works hard, she cleans her house, she's active in cooking and all those kinds of things, and an active walker. But recently, this year, she had a bad fall. She passed out because she had a recent surgery. She injured her neck and her back. And Kathy, tell me, what was it like before you saw me? Describe how the pain affected your ability to do your normal duties.
The trying just to do everyday work that I did, most generally, very easily, I had to simply stop doing it. I couldn't get out of bed very easily. I couldn't get down the stairs very easily without holding on, and I still do because I think that's probably the safest way. But it was just really very, very difficult. And I do have allergies, so I'm not able to take medication. So I had to get the exercises that were prescribed. And I did those that I could, and then I said, I better come to your house because...
Come to my house.
I have to come to Dr. Kramer's house so that I can get into working order again.
We had to get her into working order. Now tell me, what did you try, okay, before you saw me? Now she had an MRI, which was negative, and you said you went to the pain clinic?
Yes, I did, doctor, and it just didn't do anything for me, and I was a little bit upset.
Okay. Did you try heat and ice and exercise?
All of those things.
None of that worked?
None of that worked.
All right. And obviously, we adjust people differently. Our treatment as a chiropractor is a non-drug, non-surgical approach. Our goal is to improve movement and alignment of the spine, take pressure and irritation off the nerve system. However, there's a science and there's also an art, okay? And so obviously, we care for different people differently. If you're a 35-year-old, 250-pound truck driver, I think I probably would adjust them a little differently than I adjusted you.
Well, I hope so.
One of the reasons that I'm doing this is because I want people to know that there are many safe and comfortable forms of treatment, even people as young as, how young are you now?
I'm 89.
Unbelievable. So, obviously, we can personalize your care if you're concerned about, oh my God, how does he work on a big body and then all of a sudden he works on either a tiny infant or someone in their 80s or 90s. Because everything we do, we personalize your care to make it comfortable. We're well aware of the quality of your bones. We're well aware of any arthritis. If you have a disc herniation, we take MRIs. So we personalize everything to make it fit you. Now,
and you did take all those x-rays too, so we could rule out any more.
No guessing. So there's no guessing with your treatment.
Right.
We run over her MRI, we run over her x-rays.
Right.
Now, and what we did was we did adjustments to get the spine to move better, to improve the mobility, improve alignment. We gave her exercises to do. And since you received our non-drug, non-surgical treatment, you mentioned to me your stomach's about 50% better, and your neck is about 80% better, and your low back about 70. Is that correct?
Exactly.
Now, interesting, some people ask, well, how does what we do influence the stomach? Now, remember, when your spine's out of alignment or when the bones are really stuck, it creates an irritation. And the nerves in the middle part of your spine will influence your gallbladder and stomach. So it kind of creates a hyperactive nerve system. It's like you're not even worried, but you're walking around worried because those vertebrae are out of alignment, stretching the nerves, irritating them, that goes to your stomach. So when we do an adjustment, it kind of calms the nerve system. And that's a very common healthy side effect. People come in for back pain, and many times the reflux or heartburn or irritable stomachs will improve. Now, since you received treatment, what's life like now in terms of walking and stairs and cooking for Christmas dinner and all that kind of stuff?
Well, it's turned out that I'm able to do all those things now, Doctor. Unless I'm lazy one day and decide not to.
I can't imagine Kathy being lazy.
I cooked a big dinner recently for the family, and we will be cooking at my house for Christmas. And
how's your ability to sweep and walk the stairs? And
I do that just splendidly.
How long are you walking now?
I walk a mile in the morning, and I try and walk a mile at night.
Not too shabby for a young kid. Very good. Now, let me ask you this. What would you tell other people out there
What
that-
I tell them all the time, you mean?
that are afraid of having me look at their spine? Perhaps they think I'm going to break their bones or do something like that. What would you tell those people that are suffering with headaches, neck and back problems, and other things?
Well, I tell them, go and see how it works out for you. It has worked out splendidly for me for so many years that I recommend it to everybody, but then they have to come and see.
Okay, so this is, I think, a very nice story. Me and Kathy have had a long relationship. I was tall, dark, and handsome when I met Kathy, and now I'm short, bald, and fat. So, anyways, life changes, but I want to thank you for sharing your story. And those of you out there that are sick and tired of having headaches and neck pain and back pain, and perhaps you've been told that there's no hope for you, or drugs and surgery are the only options. Many times there's a non-drug, non-surgical approach. So if you would like to see if I can help you, please give us a call at 248-615-1533. If I feel I can help you, I'll tell you. If I feel that you need pain management or need surgery or need even a different approach, I'll be happy to share that with you too. I want to thank everybody. Kathy, wave to the people out there, and I wish everybody a healthy and happy New Year. We're coming on the Christmas season. God bless everybody.
Thank you.
Good job. Give me a